In this video from Stop Unhealthy Alcohol Use Now, we'll outline our approach to screening and intervention, including workflow, screening questionnaires, helpful resources, and brief counseling techniques for use in primary care. Unhealthy alcohol use includes risky drinking, as well as alcohol use disorder, abbreviated as AUD. Consumption of alcohol above the recommended limits, even in the absence of an AUD, increases the risk of health problems. We focus in this video on workflow for screening and screening-related assessment, and then on brief motivational interviewing for people with risky drinking without an AUD. Screening and interventions for people with AUD will be the focus of another video. Much like screening for depression, screening for unhealthy alcohol use typically starts with a brief initial screener comprised of 1 to 3 questions, followed by a longer questionnaire for those with a positive initial screen. The workflow begins when a medical office assistant, nurse, or other staff member, while rooming a patient either on-site or virtually, administers the initial screening questions for unhealthy alcohol use. The screening can also be done electronically through patient portals, such as MyChart in Epic. Validated questionnaires should be used, such as the Audit C or the screener recommended by the National Institutes of Health, sometimes referred to as the single question screen. The single question screen begins by asking, do you sometimes drink beer, wine, or other alcoholic beverages? Asking the question exactly as worded is important, since testing has shown that without examples of alcoholic beverages, many people assume that the question refers only to hard liquor and not beer or wine. If the patient answers no to this question, as do about half of adults in North Carolina and many other states, no further questions are required at this time. If a patient answers yes to the first question, then there is one version of the second question for men under the age of 65 and another for all women and for men 65 and older. Men under the age of 65 are asked, how many times in the past year have you had 5 or more drinks in a day? For all women and for men 65 and older, 5 or more drinks is changed to 4 or more drinks. For all screened patients, an answer of 1 or more is considered a positive initial screen. Another brief instrument that can be used for the initial screen is the Audit C, with 3 questions about quantity and frequency of alcohol consumption. Again, asking the questions as worded is important. A score of 3 or more for women and 4 or more for men indicates a positive initial screen. Patients with a positive initial screen should be asked to complete the Alcohol Use Disorders Identification Test, or audit. The audit has 10 questions, with the Audit C made up of the first 3. The audit may be completed on paper or within an EHR, where a positive screen on the Audit C can automatically open the full audit. Here we show the scoring information on the back of the paper audit. Screening-related assessment based on the audit score helps distinguish patients with alcohol use disorder from those with risky drinking but without an AUD and guides the clinical approach. An audit total score of 15 or more for men and 13 or more for women indicates that an AUD is very likely. For lower scores, an AUD is unlikely unless questions 4 to 6 contribute at least 2 points to the total audit score. These questions concern not being able to stop drinking after starting, failing to meet normal expectations because of drinking, and needing a drink in the morning after a heavy drinking session the night before. For patients engaging in risky drinking who do not have an alcohol use disorder, brief counseling in primary care is effective. The aim is to help a patient moderate their consumption to recommended levels and reduce risky drinking practices. Brief counseling can be guided by the 5 A's. Assess current drinking behaviors, advise on alcohol use, assist in exploring reasons for change, agree on options for risk reduction, and arrange follow-up. We have developed a provider pamphlet available in a paper or digital version to support clinicians in this process. This approach is based on motivational interviewing. a patient-centered guiding style of counseling that helps the patient explore and resolve ambivalence and identify their own motivations for change. Here we outline the basic skills of MI. The clinician asks permission before starting a conversation or sharing information, asks open-ended questions that encourage the patient to do most of the talking, makes affirmations to build rapport and offer support, uses reflections to encourage exploration and understanding, and uses summarizing to check in with the patient and point out how their goals differ from their current situation. In the following demonstration, we'll see how a provider might respond using the 5A's approach in a telehealth encounter with a patient who, after a positive result on the initial screen, scored 8 on the audit with a subscore of 0 on questions 4 through 6. This patient has risky alcohol use but does not have an AUD.
Hi, Tim. Thanks so much for filling out that survey on your alcohol use. And I was wondering if it would be all right if we could talk a little bit more about that.
Yeah, sure. That'd be all right.
Okay. Well, good. On the screener, I really appreciate you having filled it out, and you told me a little bit about the drinking habits that you have currently. And if I'm seeing it correctly, it looked like you're drinking about 3 or 4 nights a week generally, and having about 3 or 4 drinks on those nights, and then a couple times a month drinking a little bit more, having 5 or more drinks. Was that about right?
Yeah, that's right, Doc.
Okay. Well, could you tell me a little bit more about the role alcohol plays in your life?
Sure. Yeah, I'm a part of this trivia team, and we hit all the bars. Basically, all my friends are into it, so it's kind of a big part of my life. The alcohol is just it's there because it's a bar, but the trivia is the big draw for me.
So that's really important to you. You enjoy the trivia, and then you find that you drink while you're there.
Yeah, that's right.
Can you tell me a little bit, I don't know if you, as you were filling out that survey or if in general, if you have concerns or if you've had thoughts about your drinking or kind of how it plays a role in your life or maybe even with your health?
Growing up, my stepdad had some problems drinking, and but I definitely don't feel like that, and I feel like I don't feel like I drink more than other people I know, or feel like I'm having major problems or anything.
So nothing big comes to mind. You do think about your stepdad, and you know that your drinking isn't quite the same as him, and not necessarily different than a lot of the other people that you're around. And so it doesn't cause you a whole lot of concern right now.
Yeah, I wouldn't say it's something that I'm worried about.
Yeah. I don't know if you've ever done your own reading or thinking about the way that alcohol impacts health. If you could tell me about what you know about that.
I know my stepdad had really bad liver problems, and he ended up dying from that. But other than that, I haven't done any research or know anything about it really.
Mm-hmm. So you know about the liver, the way alcohol can affect the liver, and you saw that with your stepdad. Would it be all right if I gave you a little bit more information about how alcohol can affect our health?
Yeah, I'd appreciate that.
Okay. Well, so it really matters how much people drink, and actually, maybe that would be a good starting place if I could tell you a little bit about what we consider healthy standards.
Yeah, I'd be interested to know that.
Okay. So there's some different ideas out there, but one really kind of big idea about how much we can drink at a healthy level is what we might call 4 and 14, meaning that if we drink more than 4 drinks in a single setting, 4 standard drinks, and I'll tell you about what those are, or more than 14 drinks in a week, that we're probably at an unhealthy level of drinking. And at that level, there can be some risks for health problems. What do you think about that?
Wow. So it sounds like, from what I said on the survey, I'm probably drinking too much. Is that what you're telling me, Doc?
Yeah, that you're drinking right now is above those healthy standards.
Wow. I had no idea that there was even a level that was safe or unsafe. That's kind of worrying to me.
Mm-hmm. Mm-hmm. That's new information, and that makes you think about how the alcohol is impacting you.
Yeah. I definitely don't want liver problems or health problems.
Yeah, so that's something that you want to avoid. You don't want to find yourself in that position where the alcohol is really causing problems with your health.
Definitely. I'm getting a little older, and things like that start to add up.
hmm hmm Um, so as you get older, you don't want those things to add up. We had talked about the liver problems, and I had asked if it's all right if I share some more information about other health issues that could come with drinking above those healthy standards.
Yeah, definitely. Especially since now that I know I'm above some kind of level, I want to know what I'm at risk for.
Sure. Okay. Well, there are several ways that alcohol impacts us. Some of those are, like you had mentioned, liver problems. So people who drink above those levels are at much higher risk for things like cirrhosis of the liver, liver cancer, and other related issues with liver functioning. But there are also
Oh
some
my
other
God.
issues. Yeah, with some of those include high blood pressure, increasing your risk for high blood pressure, for heart disease, for even a
Wow.
stroke.
Oh my gosh. This has really put my drinking in a different light.
Mhm. It makes you think of it differently.
Yeah. I mean, it definitely, like I said, it doesn't feel like I have a problem, but it sounds like maybe there's some things that can go unnoticed for some time.
Yeah.
We've now seen how the provider engages with the patient in the first two of the 5 A's, assessing the patient's current drinking patterns and advising the patient of the potential consequences of these patterns. During the conversation, the provider should also clarify what constitutes one drink. This can be done using the standard drink table from the pamphlet. The provider can also share the frequency of various drinking patterns to show that most adults do not exceed the recommended daily or weekly limits. Next, the provider will assist the patient in exploring their willingness to change and their reasons for doing so or choosing not to. The importance and confidence rulers, shown here as they appear in our provider pamphlet, can help guide conversations about personal change when used with related MI principles and practices. We'll explore these tools further in our video about screening and interventions for people with AUD. In the next step, provider will seek to agree with the patient about a plan for changing their drinking patterns. Even a patient who has been receptive so far may not want to commit to change. Rather than express discouragement or disapproval, the provider can affirm that change can be difficult and emphasize that they can talk about alcohol use again if the patient feels differently in the future. In the following scenario, the patient expresses willingness to change.
So with that in mind, so you're really starting to, this is different information for you. So I'm wondering if we could talk a little bit about some ways you might even be able to make a change with that to get in line with more healthy standards of that 4 and 14 kind of idea.
Yeah, I'd be interested in hearing what your thoughts are on that. Maybe some things that other people have found helpful.
Sure. Okay. Well, I'd be happy to provide that, but I was actually wanted to start by asking you. I know this is kind of a new kind of information and idea, but I was wondering if you had any ideas. If you were going to try to make some changes to reduce your alcohol to get closer or underneath those kind of maximal standards, what comes to mind for you?
I don't even know what that would look like. I mean, the only person in my life, who's ever had bad health problems from drinking, tried a lot of different things, and like I said, ended up dying from liver problems. So I know there's meetings out there, but like that doesn't seem right for me because I don't feel like I'm there. I don't have the same situation. So I don't know. I'm just interested in what options are out there.
So here are a couple of ideas. One possibility is just kind of setting more consciously standards about how much you're going to drink when you do go out. Again, kind of really thinking about those limits of 4 and 14 and sort of planning your night accordingly by sticking to uh, those standards. That's one option. Another option might be kind of substituting a different kind of beverage. So you mentioned, for instance, when you go and play trivia, it's trivia, that's the main thing that you're interested in enjoying, and that the drinking kind of goes hand in hand with it. So sometimes people may say, I'll substitute with a non-alcoholic beverage instead of an alcoholic beverage.
Oh yeah, that sounds like.
Yeah, and another option is kind of sharing your goals with people. We find that for a lot of people, kind of speaking out loud and telling other people in your life about what you're aiming for can help build some motivation there. What do you think? What of those options, which ones seem like they might be, possible for you?
I mean, I definitely think that planning ahead, thinking about when I'm drinking, how much I'm drinking, thinking about those levels that you talked about and trying to make sure I don't go over that. And then also, it makes sense to kind of talk to my buddies about like, hey, this is a goal that I have, so that people understand why maybe it seems like I'm drinking less. Yeah, I feel like I can do that.
If the provider can arrange a follow-up appointment in 1 month, they will ask at that time whether the patient was able to make the discussed changes and then review the drinking diary together. If the patient met their goals, the provider reinforces and supports the changes, encourages the patient to return if unable to maintain the agreed-upon changes, and makes a note to revisit the topic annually. If the patient has not met their goals at follow-up, the provider can acknowledge that change is difficult, support positive change and address barriers, review goals, plans, and strategies, and renegotiate new goals. Assessment for other potentially related and treatable health conditions, such as depression or anxiety, is also important. Documentation in the EHR can maximize the positive impact of screening and intervention for both patient and practice. Approved billing codes allow for reimbursement for screening and brief counseling. Medicare, for example, has 4 reimbursement codes that can be used. Let's review the key points covered in this video. First, screening for unhealthy alcohol use is typically conducted as a 2-step process, using a brief initial screener of 1 to 3 questions, followed by the 10-question audit for those with a positive initial screen. Second, the audit can help with screening-related assessment by distinguishing people who have alcohol use disorder from those with risky drinking who do not have an AUD. Third, brief motivational interviewing in primary care using the 5 A's approach can help patients reduce risky drinking and reduce their risk of health problems from alcohol, such as cancers, cardiovascular problems, injuries and accidents, and liver problems.